Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for January 21st, 2022. Our website's falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So we have 3,714 cases. These are PCR only, so these are the PCR tests. That's how we've always tracked it. 3,714, 226 for the week. Ending yesterday. We do this on Thursday to Thursday. 90 probable cases over the past week. Sorry, I should say week. And these do not include home tests. Home tests are not counted in this. Our 14-day daily incidence rate is 154.80, so still quite high up. Again, this is between 1.2 and 115, with our worst week falling into that category. So I think, as the cases, and I'll show you in a second, have gone down a little bit from the last 2 weeks, it won't necessarily be reflected because there's a little bit delay. So now you're seeing that highest number because it is now into that that particular bad week we had 2 weeks. Not to say that this week is good. Positivity rate's 19.65. Part of the reason why that might also be, that's going to be high, a lot of cases definitely going to be high. One other reason is if you're verifying that you had a positive home kit with a PCR, then that's an audience that is obviously symptomatic and have already shown a positive on a test. That'll tend to kick the numbers up, I would think, but whatever, it's still a high number. It would be a high number with the amount of case counts, so it's still a high number any which way you cut it. So if you look at our weekly case trends, again, we have had 2 weeks where you can see a decline, similar to the rise, about half as much as the rise. So this really bad week that we had 3 weeks ago, that's being captured in these incidence and positivity rates. That's why they continue to show higher from last week, even though the case counts have gone down. It's because it's capturing more this period of time that I'm circling with the cursor, the top 2 weeks. Nonetheless, it's still the most cases we've ever seen, and that doesn't even count home tests. So you may as well at least double it for what we were having for case counts. So this chart, the closer the dots are to form a line, and the flatter the better. And you can see, again, we had some really, starting 1, 2, 3, 4, 5 weeks where this starts to separate and goes up really high. That's an indicator of an outbreak. Tighter and flatter they are, we're doing better. So I think things will get better. You can start seeing the cases peak. It looks like in the state, when we go to the state chart and you see the county chart here, things may have peaked. I would want another week or two to say that for sure, but it does seem like it's starting to come back down, also in the county. You can see that the 2 to 3 day average was 1,200 at the peak. They're at like 9 something now. So we'll see what happens. Deaths among this. Now, talking about cases, that's just talking about cases. So an individual's likelihood of getting hospitalized or dying from COVID right now is significantly lower than it was previously. So any one individual was generally going to have a better outcome due to Omicron being less likely to cause a lower COVID pneumonias and the deep lung issues. Also, the vaccine and the booster. And so cases, when you see in the green in the middle where we're having 16, 13 3-day death averages on the county, those were based on case counts in Falmouth of 80 or 100. So when we see 400 in Falmouth, and you see like a 5 times increase, you're not seeing hospitalization go up 5 times. It's actually stayed below those previous levels, and that's one of the indicators that the hospitalizations and deaths this is the chart of deaths, is less at this point in the pandemic, at this current surge that we've had of cases. If you look at hospitalizations, last week we were at 15 and 4, week before 14 and 4, 12 and 3. So sort of similar. We're not seeing, we didn't see that rapid increases. Hospitalizations could have a little bit of a delay from the real bad week of cases. It might take till next week before they see the hospitals get really full. We haven't seen it though. Cape Cod Hospital is definitely seeing a high number, but I think similar. When we go to this next chart, this is last year's COVID presentation for a similar time frame. So let's go around the 12th to the 19th, Cape Cod Hospital. So there's definitely more in Cape Cod Hospital, not in the ICU though. So you see 483 for the ICU at Cape Cod Hospital. Same time frame last year was 7, 10, 18, 18. So that's where the vax, the boosters, and Omicron being a little less than Delta as far as the ICU. That's where the data tells me that Your likelihood is definitely higher to get it at any other time of the outbreak over the last couple of weeks. But the hospitalizations are not. And so let's jump to the state cases. There were 14,000 last week at the same time. It was like 18,000. The highest was somewhere around 30,000. So very high numbers, but better numbers than a couple of weeks ago. Looking at the trends, you see a drop. In the blue upper right is number of cases. The testing percent positivity, they're both showing declines. Hospitalizations look like they might be flattening out by that curve of this. It's starting to, but it's still, it's been an upward swing. And deaths have not gone that sharper spike. Again, another indicator that hospitalizations and deaths are lower at this point with the boosters in Omicron. Looking at incidence rates, we sort of fall in the middle. Falmouth is 154.8. The state was 278.9, so better than the state we typically do. So we're in the probably upper third for the county. Positivity, same thing. We're pretty close to the state for positivity. Everybody seems to be huddled around in the teens to 20 around the Cape. This chart also is another indicator about Omicron. This number over here, I'm circling the 1.56%, is the number of hospitalizations among vaccine breakthrough cases. So it says 348,510 total number of breakthrough cases, or 6.8% of the population. Last week it was 262, so over 100,000 breakthrough cases, with about a 900, 800 increase in hospitalizations. But that percentage has dropped. So that keeps dropping. The highest it was when they first showed this chart was closer to 4%. It's 1.56. Why would that be dropping? We're getting further away from our series of vaccinations. Most people, if they chose the vaccine, was probably done in the spring of last year. And so that number is actually dropping each week. It was 1.7 something last week. And that just indicates vax booster and Omicron being less likely to hospitalize you, and boosters continue to keep giving out boosters. So 1.5% of the 348,000 were hospitalized, and less than 1% of 0.35, so a third of 1% deaths among vaccinated people. So that's sort of the silver lining in the number of cases, is that it's not as a severe hospitalization and death rate. Sorry to be repetitive, but. And as far as our vaccination rates, so we have 95% of all eligible residents has had at least one dose. So somebody's had some vaccine, whether they've had their full series or not. 95 out of 100 people. 83% of all our eligible residents are fully vaccinated. So there's a drop-off between the first and second dose. We've always had that. I think everybody does. Some people they felt a reaction or did not want to participate in the second shot. 894 first, second, and booster doses administered. So we went up 605 in our boosters, 112 on our second doses, and 177 on our first doses. We're about 45% of the entire population is totally boosted. About almost a little under 50, I think about 48% of our eligible residents, because not everybody's, you can't be boosted if you're not eligible to be vaxxed if you're under 5. The county went up 6% and is at 55% of the population is fully vaccinated with boosters. So we're a little bit less than that. So if you can be considering a booster, I went on today online. I'll show you some places to get it. I've seen some openings. We just had a clinic, and it actually didn't sell out this week. Not sell out, but register out. It was pretty close, but we didn't fill it. So that's where we are for vaccinations. As far as the vaccine, vaxfinder.mass.gov is your best place. You can also dial 211 if you do not use a computer. So it's, again, the pharmacies, the health centers. Barnstable County Health Office does it Wednesdays at their office at the Barnstable County Complex. They're in the old jail, the conference room, the Harborview conference room. Wednesdays 10 to 4 for adults, with a PD Vax available from 2 to 4. Cape Cod Community College, that's with Mass DPH. Sunday 2 to 12 to 6, Tuesdays and Thursdays 8 to 2:30. So that's a place you can get it. You can also find that. I found that in both spots, both going on barnstablecounty.org and finding the link, and also on VaxFinder. So at VaxFinder, you'll see Cape Cod Community College, you'll see the pharmacies and so forth. If you're homebound, they can't make it to a clinic, know someone who's homebound, they need to reach out to the health department. Again, 508-495-7485. And we'll get the VNA. It can happen quick. So we'll send the VNA an email with your information, and they'll call, very short order, and schedule that with you, or schedule it for the individual that needs it, okay? The VNA helped us do a clinic to Gus Candy this past week. It was on the 19th. Like I said, we'll do more. We'll do another one. We'll do it through the website. We'll do an email push, blast through the senior center. Try to advertise it. Maybe we didn't advertise it quite as well. I'm not sure, or just there's plenty of other places to get it. But anyway, there's your vaccine availability. Sorry. Booster doses. Again, this is from the CDC. So Pfizer, 12. At least 5 months after completing your primary COVID series. Used to be 6 months. Okay. 12 to 17 can only get Pfizer. The rest, others could get Moderna or Pfizer. You could get J&J, but it's recommended. It seems like preferred that you would stay with the mRNA-style vaccine. Moderna's 18, and again, 5 months. Again, you can mix and match Pfizer and Moderna. You can do J&J, but it seems like it's recommended that you stay with the mRNA. J&J 18, at least 2 months, and they prefer you get a mRNA for the second. But again, you can do a booster of J&J. Again, 211 or vaxfinder.gov are the two places where you can go to get a booster dose. Testing, school-based test and stay has been replaced. It's just been impossible. Falmouth's been able to stay with it. Other towns have had to scale it back or not able to do it. Schools are not mass testing centers. They had to become mass testing centers to test dozens, if not 100 kids a day. It's going to be replaced, and I don't have all the info yet. The schools do. The schools are already, they can run with it. It's like a pool testing and home kit sort of strategy. I don't have a name for it, but it is being replaced. The test and stay, probably 98 to 99% were negative, so they're trying to figure out a better way than just doing a ton of effort for not necessarily catching a lot of the disease per se. A lot of emails, a lot of calls. So the school-based test and stay is going to be over. Again, if you want details, you should look at the school's website or contact the schools. I have to do a little more research on it, but right now that's where we are. Convenient MD and the pharmacies still do the testing like they always have. The hospital does. The fairgrounds is now at the Cape Cod Church during the winter. It's just cold out there, so if you go on the Barnstable County website, when they do the fairground, typically on Thursdays, they're going to use Cape Cod Church for that, right across the street. That's the one on 151, a very large church right across from the fairgrounds. They have heat, so that's one of the primary reasons. The Community Health Center of Cape Cod, I believe, is also going to do testing. I think if you're tied in with them, they probably have information. Home kits are huge. There's home kits around. There's the I wanted to put a slide in to get a chance, but United States Postal Service, the feds are doing it through the Postal Service. The state's been ordering some. The schools have ordered some, and I'll have to put together some places where you can get them. I can put that on our website. I just got to work on that. But home tests are, sort of where we're at with a lot of this testing. Again, they're not going to get contact traced. The VNA is not going to know to call you. We're just not going to be in the system. The guidance is on the COVID page at Falmouth right at the top before I put this presentation in. Right at the top, it's got the link to what the 5 days, keeping yourself home for 5 days at a minimum. And so that's trying to work on more individual responsibility rather than the government continue to call you and the health department calling you, the VNA calling everybody, trying to call the contacts. It's getting more to a home test situation. And Stop the Spread site is still running at the Melody Tent. That's a state. It's free. That's Mondays 9 to 1, Tuesdays 1 to 6, and Wednesdays 9 to 1. So there's your options for testing. Isolation and guidance, again, it's a 5-day minimum. After that, continue to wear a mask for 5 days. If your symptoms have substantially resolved, you can return. Okay, so this if you're a close contact, if you've been boosted, you don't need to quarantine. Just wear a mask for 10 days. Test on day 5 if possible. But if you've not been vaccinated or you haven't not been boosted, then you have to do the 5-day quarantine and then wear a mask. It does say if you can't quarantine, you must wear a mask for 10 days, but it is asking you to quarantine. Again, if you ever develop symptoms, get tested. The thing about home kits, just remember, I don't know if you know this, they're definitely not as perfect as the PCR in terms of finding it. So there are some, especially early on, false negatives. If it's positive, it's positive. But if it's negative and it's early, like you tested, like soon as you knew that your Aunt Susie got COVID and you were with her, then you automatically tested, it's going to be negative, even a PCR at that point. Even when you start early on in your symptoms, sometimes these will test negative. I just want people to know that they're not, they weren't they weren't designed for Omicron per se. So and Omicron tends to reside more in the throat and less in the nasal passages. So sometimes we're getting it, and maybe by day 5 is when it starts to show up. So, that's the thing. If you're exposed, wait at least 5 days. If you're symptomatic, get a test right away, but then verify it within 24 to 48 hours. Got a call today about that happening. Somebody was negative when they first got symptoms. They thought they were negative, but second test determined that they were positive. So that's kind of the tricky thing with home tests. They're not 100. Nothing's 100%. Definitely not. That's not 100%. So that's what I have to say about home kits. But they are good. They just are what they are. So if you're negative with symptoms, I would recommend within 24 to 48 hours, grab a second test. Grab that second test and do it that way. And again, if you have symptoms, you shouldn't be at work, at school or somewhere. If you got symptoms, worst case scenario, at least have the mask on. But if you got any symptoms, if you're going back to work because you've tested negative and you've got some symptoms, it can be other things. Grab that test in 24 hours. You're negative, and keep wearing a mask. I'm not saying you have to quarantine until that second test, but just use your head. Keep a mask. Keep away from others. So that sort of layering system, as far as trying to keep others safe. Okay. Again, vaccination records. I did something on this last week, but you can access your vaccination records through the myvaxrecords.mass.gov. It's kind of what the first page, and then the second page, you start filling out the information, put in a PIN number, yada, 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 and you should be able to get that. Just be careful when you put your first name and last name that it matches what your Vax card had. If your name is Suzanne and you put Susie, it may not pick up on it, so I don't know how good their search engine is. Just be aware of that. Omicron. Omicron shown in purple, Delta's shown in orange. You can see how quickly, since about Christmas, where it was about 55, close to 60%, it's already like 99%, 98%. It's jumped really quick, so it's pretty much pushed Delta out of the way, at least up here in this part of the country, most of the country. It is more transmissible. It's definitely outcompeting Delta. Delta outcompeted the original COVID. Less severe outcomes in general. Doesn't mean people don't get sick and die from it, especially those that are unvaccinated. But a real weakened immune system, perhaps, that's still occurring. Again, I showed you the percentages of that, and that's, if you think about the population, if it's 0.35 deaths among vaccinated individuals in Massachusetts, out of every 100 people, there are some very, sickly people, unfortunately, or very elderly people, and that's usually what ends up happening. So, again, by and large, the severity is less, and vaccines work, especially if boosted. So, that's what I have to say about Omicron. So, as far as face coverings, nothing's changed since the 11th of this month, where the Select Board adopt the mask requirement at town-owned properties. Rec center, senior center, libraries, town halls, etc., mask required. Our metrics are terrible. Again, there's a little bit of delay, so it's not going to start coming down until probably next week, based on the case counts we're seeing this week. Again, our over 100 is considered high. We're at 1,000, so we're 10 times higher. That's outbreak status. Anything over 10% positivity, we're at 19. We're blown way over to here. We hung in that moderate to low for a while, but it's for positivity anyway. Hospitalizations are holding steady. They didn't see the increase that I thought you might want to see when you were 15. If not, thought you would see at 12 and 3 for Falmouth. It's high, but not proportional to the amount of cases we're actually seeing compared to previous outbreaks, surges. Our vaccinations, of course, are in good shape. Again, our case counts are highest that we ever have, but we seem to have tapered off the last couple of weeks. It's going to take a while for it to come down from that number. So I think hopefully by March it looks better, maybe even by the end of February. We don't know. It's been dropping by 100 per week in PCR, so we're seeing less cases, but hopefully that continues. 98% plus are Omicron. Urge face coverings, especially if you have your vaccination status, your health conditions. We still having a strong advisory for all public indoor places. That's, but not a mandate. Only the time we have a mandate is town-owned buildings. Again, think about your health status when you make your decisions. Vaccine eligibility. Again, I think people want a vaccine. It was still people getting first doses, so people have changed their minds. So we are seeing people still getting vaccinated. Third dose boosters are available. Consider them. They'll really help your first series of vaccine. They do help. And you're much more likely, if you definitely still, this was an older slide, I need to recalculate that, it takes a little while, but last time we did it was 5.7 times more likely to get COVID if you're not vaccinated, right? And CDC data suggests 5, so, I pick a sample of a couple hundred cases and do the math and figure out where we are with that. I just have not done that in a bit. So, again, I'll give you an update again next week, but that's where we are at for this particular week, and see everyone next week. Thanks.